Dr. Sharfstein, we often focus about the US, but actually there's a number of cases rising in a number of emerging markets, but also Japan, emerging markets such as the Philippines and Vietnam. What do we know about where the number of cases increased significantly?
This is a major concern. I think the world is hitting records in the total number of coronavirus cases. So we are really in the thick of the pandemic, and we're seeing surges in the Philippines and in Vietnam, which have not had serious coronavirus outbreaks to date, and even Japan has had the highest number of cases that it's reported. I think in Japan, the answer is very clearly that they completely opened up. They acted like the virus was behind them. That is a mistake that every single country in the world will make at its own peril. In the other countries, they had been almost completely spared at the beginning, and people wondered, was it some, special thing? It probably was just good, little luck and very good public health work, and they're going to need some of both probably to get this under control.
So how should we be looking at this? Is it better to be in full lockdown for a shorter amount of time to save lives than a kind of, open, not so open phase for longer?
Well, I think the story is a little different between those different countries. I think a lockdown is necessary to really, control the spread. And then when it comes way down, you can't stay locked down forever. You just have to be prepared that a loss in vigilance or even some bad luck will lead to a resurgence. And then you have to be able to have the capacity to respond to that. And so we're going to see the public health systems of Vietnam and the Philippines tested. And that's not just locking down. That's all the tracing, all the testing, all the things that have to happen. I think Japan, even though it is having a surge of cases, should be able to respond to this. There's still relatively very few deaths in any of these countries, and if they can respond effectively, they should keep this down. It is not surprising that we'll see these surges from time to time. The key is whether people can beat them back.
Are the winter months in the Northern Hemisphere going to be much worse?
From the United States perspective, it's getting hard to imagine much worse because, the virus is in so many places rising so quickly, and our rates are so high. I think that it's possible that it could be worse, particularly as flu comes. If we're able to control the coronavirus through distancing, the flu season may not be so bad. On the other hand, we're not able to control the coronavirus through distancing, so we may still have, it may be even worse with the flu season. So, we don't know. It wasn't that long ago that people were saying, I think the summer's going to be way better. It's very hard to predict with this virus. I think we just need to be focused on the severe situation we're in right now.
Okay, what drugs work to try and cure the sick, and which ones don't?
Well, the drugs with evidence are the remdesivir, steroids. There's an inhaled immunomodulating drug, and we know that hydroxychloroquine and azithromycin do not have evidence for them at this point, and shouldn't be used. So it's and I would say that the other thing that has a growing amount of evidence and may be even more widely used soon is convalescent plasma, using the antibodies from people who have recovered to treat, and there's some definitive studies that are happening now, but there's emerging evidence from repeated studies of benefit there.